What are statins and should you take them? So statins are a very safe, very effective tablet oral medication that you take once a day to lower your cholesterol. And the reason why that's so important is that unfortunately cholesterol is one of the leading causes of illness in the United States. It's the number 2 driving risk factor for cardiovascular disease, which is the number 1 cause of death. So everyone out there, if you're worried about your health, definitely be mindful. When you go to the doctor, if your cholesterol is too high and they talk to you about taking a statin, you should be open to it. There aren't a lot of real side effects. The main one's muscle cramps. It happens about 10% of the patients. And for those patients who are typically just discontinuing the medication, use something else. There's a lot of information in the news right now about memory issues. There's really no data to suggest that. There's really not a lot of other real side effects or issues that occur with statins. They're one of the most used, most best tolerated, most effective medications we have. And definitely if you're someone who needs it, the benefit will almost always outweigh the risk because again, statins help prevent the number 1 cause of death. Some examples are going to be atorvastatin, simvastatin, rosuvastatin, pravastatin. As you can see, they all under the name of statin. They're very cheap, they're very effective. And again, because cardiovascular disease is such a big deal, this is why these medications matter. I also want to add that especially for diabetics have an even higher risk for cholesterol issues or LDL issues, and they're even higher risk for cardiovascular disease complications. So definitely for anyone who's diabetic, their doctor's telling them to take a statin, you absolutely should, because that's going to be your biggest concern. So again, statins are your friend. They're safe, effective, and cheap. They help lower your cholesterol. And the reason why that matters is the high cholesterol is one of the leading causes of illness and death in the United States, primarily through cardiovascular disease, especially for those that are diabetics.